Good afternoon to my colleagues, to the staff, and to all the testifiers. Thank you for the work you do and for all the testimony that you've provided. It seems to me from all that I'm listening to, I keep hearing about CMS, I keep hearing about federal standards, but it seems to me that at this point, it's our solution. Because, as if I understand it correctly, if you put the seniors at Queen Louise, it's not CMS certified, so you're not going to get any reimbursement for their care. So there's going to be 100% local funding, right? Correct?
Yes.
And if you put them at Herbert Grigg, which is not CMS certified, you're going to pay 100% of their care. Is that correct?
Yes.
And if you leave them at SeaView, which is not CMS certified, you'd have to be 100% for their care. Is that correct?
Correct.
Okay. So it's our decision to make what we want to do going forward, even if in the end, the decision is made to seek CMS recertification for SeaView, correct?
Correct.
Okay, good. Now, I went to church with the governor for a service for the Department of Education. It was at the St. Thomas Assembly of God. And unlike some of the time when I go to church, this was really meaningful. And he talked about, the Pastor Phillips, he talked about leadership and the qualities of leaders. And the first thing he said? Humility is the essential thing. And I think humility, I can't hold myself above anyone. I'm as capable of making a mistake as any other person. And no matter what is said here today, Dr. Roberts, I believe you made a mistake in interpreting the HUD letter and you acted. I think what should have happened after that is that we say we made a mistake. And instead of digging our heels in, let's correct the mistake, which is we took these residents who have lived in a place. Ms. Connor told me one as long as 22 years, right? The average, 10. You took them up, no belongings, no medication. You deposited some of them at the emergency room where they stayed for 3 days in some cases, and you took others to Queen Louise, right? I have been to Queen Louise. As a matter of fact, Queen Louise came here and testified, just a few months ago, that they needed basic things, a commercial washer, hot water heater, a fire alarm system. Their top floor is unusable. The people are there in cubicles. I have been going to SeaView since I worked at the Department of Education with the adolescent wing, the students placed there for special education. I have visited patients at SeaView. When we were there on Saturday for this meeting with the residents and their families, there was not one single person who made a complaint about the quality of care received at the facility. I mean, in essence, what we've done is respond to this letter, move them from a place where even the governor acknowledged that the public facilities are not in better condition. And so now here we are talking about compounding the mistake and sending these people, these residents, away from their families. Even in St. Croix, it's still away. The residents' families testify that they go there every single day and that these residents look forward to seeing them every single day. And I think that's where we need to focus. Pardon my French. To hell with CMS. I could care less about what CMS standards are at this point because it's only money. It's only whether they're going to reimburse us or not. All of the things pointed out have nothing to do with the quality of care. None of it has to do with the quality of care. And I think that is where we ought to be centered. Now, the Attorney General said, in justifying your action, he said it doesn't begin with the HUD letter. Even if we say you misinterpreted the hot letter, it doesn't begin with the hot letter. Okay, fine. But if it begins further back, it makes us look even worse because it means that we had even more time. If we go back to when CMS stopped paying, if we go back to CMS decertification, it means we have had more time to have dealt with the plan, and we haven't. I believe that the solution to this is to put the patients back to where they were in the familiar setting with the familiar people who took care of them, and for us to now move forward with the plan. Not to dig in our heels any further. When I went out there after the health inspection at SeaView, the cafeteria cleaner than some of the restaurants I eat in. And I have been in the rooms, I've been in the bathrooms, and I believe we can correct this mistake. And we don't have to be referring back to CMS talking about what they want. I don't care what they want. We want quality care for our seniors. And if we're all agreeing that it was provided at SeaView, that's where they should be while we figure out the solution going forward. I don't want to point any more fingers. I am not going to throw any more darts at anybody. But stop digging in. Stop trying to find now justification to make SeaView look bad, because it doesn't. That's where we need to be. CMS isn't telling us to keep them at Queen Louise. It isn't. It isn't telling us to put them at Herbert Gregg. That's our decision. And we could decide something better. Thank you all very much. Thank you, Mr. Chair.